In the heart of Kerala, where ancient healing traditions meet cutting-edge medicine, a medical revolution has been quietly transforming lives for more than 3 decades, guided by the visionary approach of a venous surgeon who dared to reimagine the treatment of a very common illness.
Every day, due to varicose veins, millions suffer in silence. Their legs heavy with pain, their confidence shattered by unsightly veins. In more severe cases, the condition leads to painful ulcerations that further impair mobility and quality of life.
People with varicose veins often experience a heavy, aching sensation in the legs, along with burning, itching, or throbbing discomfort, especially after standing for long periods. As the condition progresses, it can significantly impact daily life, restricting mobility and causing ongoing pain. In more severe cases, varicose veins may lead to skin changes and painful ulcers, particularly near the ankles, further reducing comfort and quality of life.
Varicose veins are more than just a cosmetic concern. These enlarged, twisted veins, often visible as blue or purple bulges on the legs, ankles, and feet, are commonly associated with discomfort and swelling. They are generally considered to result from failed vein valves, which disrupt normal blood flow and cause blood to pool in the affected areas.
How does one break free from this silent burden, this creeping discomfort that drains vitality day by day? What is the real solution to this stubborn and often ignored disease?
Often, surgery is considered the solution, but what if there were a better way?
In this small town in Kerala's Kottayam district, one surgeon dared to imagine a different future. For 3 decades, within the walls of St. Thomas Hospital in Changanasheri, Professor Dr.N Radhakrishnan has been rewriting the rules of vascular surgery, transforming what was once a painful ordeal into an art of precision and hope.
Inside its operation theatre, a calm and compassionate surgeon with a gentle smile has been leading more than 55,000 patients from the depths of pain and despair to the shores of comfort and renewed hope. That surgeon is Dr. N. Radhakrishnan.
Professor Dr. N. Radhakrishnan does not just cure varicose veins. He restores people's normal life. His patients arrive in his clinic unable to stand for their routine work, unable to perform enough at their work, or waking up at night in agony with aching legs. Even everyday tasks, such as cooking or shopping, become demanding struggles against their own body.
Dr. Radhakrishnan recognizes that all his patients deserve the freedom to navigate every step of their lives without pain and suffering. His work gives back what most of us never value until it's lost: the simple ability to stand, walk, and live free without making their body a hindrance to themselves.
While many dismiss varicose veins as a mere cosmetic concern or minor inconvenience, Dr. Radhakrishnan approaches each case with the seriousness it deserves, recognizing it as a complex medical condition with significant physical and systemic risks. His care is not just treatment, it is a deep human response to suffering, grounded in science, skill, and empathy. This is the story of Professor Dr. N. Radhakrishnan and his groundbreaking approach to treating varicose veins, an approach that challenges conventional wisdom and offers hope to those who have been told to simply live with their condition.
To understand Dr. N. Radhakrishnan's breakthrough, we must first understand the enemy he's fighting. Contrary to popular belief, varicose veins are not merely a cosmetic issue. They are a sign of a progressive condition called chronic venous disease.
Varicose vein is not a disease. It is a normal physiological phenomenon of every vein in the body. When it is flowing against gravity, the stress because of a gravitational force and the weight of blood, there is a push and a pull. That creates the vessels dilate. That is called varicosity. And we are concerned not about the dilated veins, we are concerned about the diseases of the lympho-venous system.
Most people see the twisted, bulging vessels beneath the skin and assume they're looking at a disease called varicose veins. The term varicosity has been misused for decades. It doesn't describe a medical condition, it describes a natural characteristic of veins.
When blood flows upward from below, two forces work together: gravity and the weight of the blood itself. These forces push blood downward, giving the vein a dilated appearance. When these forces are not at work, veins appear shrunken. This is completely normal physiology. But when this natural dilation goes beyond normal limits, something else begins. Not simply chronic venous insufficiency, as it's commonly called, but chronic venous disease, or CVD.
For years, doctors blamed prolonged standing and walking. The logic seemed sound. Spend more time on your feet, damage your veins. But there was a problem with this theory. If standing were the true cause, both legs would be equally affected. They bear equal weight and stress. However, the disease usually affects only one leg or a particular segment. This suggests genetic predisposition, a weakness in the vein wall that affects some segments more than others. Age, profession, pregnancy, prolonged standing, these can worsen symptoms once the illness starts. But they are not causes, they're promoters.
Traditional medicine focused on valve failure. Clinicians believed valve dysfunction initiated the disease, while pathologists described the relationship between wall weakness and valve failure as an egg-chicken theory. Which came first? This theory is scientifically unsound. The structural elements of the venous system are primarily elastic in nature. The etiological factor is genetic, influencing the quality and integrity of the vein wall's elasticity. Since both the vein wall and valves derive from the same structural framework, genetic weakness affects both simultaneously.
Think of it this way. The valve is merely an endothelial fold. It cannot remain competent if the surrounding vein wall becomes weakened and distended. As the wall expands, valve leaflets are pulled apart. Wall weakness precedes valve failure. Valve dysfunction then leads to progressive venous pressure increases over time. This sustained venous hypertension triggers a cascade of pathological tissue changes that may ultimately lead to ulceration. Chronic venous disease affects venous and lymphatic stagnation primarily in the lowermost part of the body, typically the area covered by regular socks.
The classification of varicose veins from class 1 to class 6 isn't determined by the number of visible dilated veins. It's based on progressive pathological changes in the lower leg segment. Visible veins, though cosmetically significant, usually cause problems only through bleeding or thrombosis. The true burden of the disease, the lifelong misery of non-healing ulcers, originates at the microscopic level.
We're talking about the smallest veins, venules and venulets, that measure as little as 0.008 millimeters in diameter. This microvascular level is crucial to understanding lymphovenous pathology.
If this microscopic segment remains healthy, no major problem arises. But if it's structurally weak, venous pressure amplified by gravity and blood weight translates directly into increased capillary pressure. Capillaries dilate. excess tissue fluid leaks into intercellular spaces. Microcirculation becomes impaired. The lymphatic microchannels that originate in this same space become overwhelmed. When the lymphatic system fails to drain accumulating tissue fluid and cellular waste, it causes progressive tissue damage and cellular death, ultimately resulting in ulceration.
The main vein draining blood from the entire lower limb, the deep vein, is well protected by bones and muscles, extending from foot to upper thigh. The calf muscle, located between knee and ankle joints, functions as an auxiliary pump. While the heart serves as the central pump, the calf muscle plays a crucial peripheral role in venous return against gravity. In contrast, superficial veins lie within subcutaneous tissue, connected to the deep system through perforator veins. The superficial venous system plays a supportive role in maintaining proper circulation, particularly in cases where there is obstruction or dysfunction in the deep venous system.
Understanding human development reveals why we face these challenges. The vein is the origin of the cardiovascular system. During the 3rd week of gestation, our cardiovascular system begins forming from a vein bud. During intrauterine life, the fetus remains head down and flexed. At this stage, non-return valves exist in all veins throughout the body, from feet to head. Humans are unique in standing upright. All other animals maintain horizontal posture relative to Earth, so they don't encounter the same gravitational challenges in venous return.
By the time a human begins walking, venous valves above heart level regress, while those from feet upward persist. The highest concentration of valves is found in the lower limb, especially near the feet. The heart's direct pumping control extends only about a handbreadth below the knee joint. As children grow and start walking, the lower 2/3 of the leg and foot become functionally beyond direct cardiac control. To compensate, the calf muscle evolves into a peripheral pump. Consequently, most venous disorders localize to the lower 2/3 of the leg and ankle joint area, where gravity effects, poor venous return, and valve failure are most pronounced.
During diastole, venous pressure in deep veins is highly negative, assisting blood return to the heart. The superficial venous system often experiences venous hypertension due to abnormal vein dilatation. The commonly held belief that blood escapes from deep veins with high negative pressure to superficial veins with low negative pressure, then flows toward high positive pressure areas, is physiologically illogical.
In a diseased state, as the heart suctions blood from the deep venous system, the so-called diseased perforators and incompetent junctional valves actually facilitate free blood flow from superficial veins into the deep system. However, due to progressive dilatation and structural weakness in superficial veins, residual blood stagnation occurs, leading to persistent superficial venous hypertension. The effects are most pronounced in the lowermost body parts, particularly around ankles and lower legs. Veins in upper thighs and legs are wider, carrying larger blood volumes, whereas veins and venules near feet and ankles are much narrower.
This diameter difference causes pressure buildup at the bottom, similar to water in a funnel exerting greatest pressure at its narrowest point. Small veins in the lower leg and ankle bear the pressure brunt, making them most vulnerable to long-term damage. Here's the crucial point. If microscopic veins near capillaries remain healthy and functional, dilation of large visible veins alone doesn't lead to chronic disease. It's microcirculation failure, not merely visible vein appearance, that determines disease progression.
If microscopic veins closer to capillaries remain healthy, even if several nitroscopic veins become dilated, the patient will never suffer from chronic diseases.
While most doctors focus on the visible, rope-like veins that appear on the thighs and calves, Dr. Radhakrishnan made a crucial discovery. It's not these large veins that cause the most serious complications. Rather, it's the microscopic veins, thousands of tiny vessels, invisible to the naked eye, especially those in the lower third of the leg, ankle, and foot.
These microscopic veins, when affected by valve failure, create pressure that backs up into the capillaries. This triggers a cascade of events. Excess fluid seeps into surrounding tissues, the lymphatic system becomes overwhelmed, and cells begin to die. The result can be devastating. Painful ulcers that refuse to heal, sometimes lasting for years or even decades.
While most of us have heard of varicose veins, few realize they can progress through 7 distinct stages, from hidden symptoms to discoloration, swelling, and ultimately, these debilitating ulcers. According to Dr. Radhakrishnan's research, this condition affects not just the 15 to 20% of people commonly cited in medical literature, but potentially up to 80% of the population, to varying degrees.
For centuries, the medical approach to varicose veins has remained largely unchanged. Traditional surgery involves tying off and removing large surface veins, a procedure known as stripping. More recent techniques like laser treatment and radiofrequency ablation use heat to close off problematic veins.
But Dr. Radhakrishnan noticed something concerning. Many patients who underwent these procedures would experience temporary relief, only to develop worse symptoms later. The underlying problem remained unsolved.
All these open procedures are non-physiological and centuries old. There is no scientific basis. Any proximal block in the vein will aggravate the venous pressure below that level, as venous flow is from foot to heart.
My technique, that is a modified microfoam sclerotherapy, that is totally different from the other methods, because it is mainly focusing towards the capillary level. It is actually destroying the diseased veins so that the new veins will develop in this area and take up the circulation. And non-healing ulcers will heal very fast, whereas when it is blocked, as in usual practice, proximal part, the condition becomes worse.
The conventional approach to varicose vein treatment followed a top-down method, starting with the larger veins in the thigh and then addressing those lower in the leg. But Dr. Radhakrishnan saw a fundamental flaw in this logic. He recognized that by sealing off the major veins above without first treating the intricate network of smaller damaged veins below, the pressure could build up and aggravate the condition. His insight flipped the treatment strategy on its head, prioritizing the microscopic roots of the problem before addressing the larger vessels. Conventional treatments focus on eliminating the visible highways, the large superficial veins, aiming to block blood flow through interconnecting junctions or perforating veins. But there's a different approach, one that works with the body's natural design rather than against it. Dr. Radhakrishnan's approach targets the neighborhood streets first, the tiny vessels where the damage begins. By sealing these vessels from the bottom up, he prevents pressure from building in the microscopic networks.
The microcirculatory impediment at the capillary level is the core problem of chronic venous disease. The weakness of the valves and vessel walls of large vessels is not the primary problem.
In 1995, Dr. Radhakrishnan began exploring an alternative approach to treating varicose veins through sclerotherapy, a method that involves injecting a solution into the vein to induce scarring and closure. Over the years, by 2007, through persistent refinement and clinical insight, he evolved this technique into what is now known as modified microfoam sclerotherapy, a safer, more effective, and patient-friendly advancement in the management of venous disease.
Unlike conventional techniques, Dr. Radhakrishnan's method takes a bottom-up approach, beginning with the tiny, often overlooked vessels in the foot and ankle, and then progressing upward to the larger veins. the treatment employs a precisely diluted solution of polidocanol, transformed into a fine microfoam by mixing it with air.
What makes Dr. Radhakrishnan's technique truly revolutionary is his use of a universal dilution of the medicine used, employing a 0.25% concentration of polidocanol for all vein sizes. Unlike traditional methods that use higher concentrations for larger veins, this consistent low-dose approach allows for broader coverage, safely treating both tiny and large veins in a single session with minimal medication.
This foam can navigate and penetrate even the smallest, most delicate veins, ensuring a more thorough and lasting result.
The modified microfoam sclerotherapy is exactly the opposite of the conventional method practiced throughout the world. This gives excellent results in non-healing ulcers, especially after repeated various surgical interventions and those left to fate.
The results have been nothing short of remarkable. Even patients with long-standing, non-healing ulcers, many of whom had already gone through several failed surgeries, began to heal.
Foam sclerotherapy, especially with microfoam, presents distinct advantages over liquid sclerotherapy. By mixing the sclerosin with air, we achieve a highly diluted yet effective formulation. The microbubbles in foam are coated with a thin aqueous layer. Due to surface tension, the drug remains in intimate contact with vein walls, enhancing efficacy. Forceful foam injection into veins allows it to reach microvenules, small vessels often missed by conventional methods. The foam doesn't primarily target large veins, but effectively treats early-stage varicosities and microvascular insufficiencies.
The retrograde and circumferential spread of foam ensures complete contact with the endothelial lining. When injected under pressure, foam mixes with blood plasma proteins like albumin, which stabilizes the sclerosin, making it more persistent and active at the action site.
The microfoam creates a controlled chemical burn on the inner lining of the vein walls. These walls become inflamed, stick together, and heal through scarring. The process effectively seals off the problematic vessels, allowing blood to be redirected through healthier pathways. The future of venous treatment lies not in destruction, but in understanding and working with the remarkable system nature has designed. This isn't just a different treatment. It's a completely different understanding of the disease itself.
One that recognizes the true enemy isn't the visible veins we can see, but the microscopic battlefield we've been ignoring. With over 55,000 procedures performed, Dr. Radhakrishnan's method has stood the test of time, proving to be both safe and highly effective.
I had this ulcer on my ankle for 8 years. I'd been to so many doctors, had 3 surgeries, and nothing helped. The pain was unbearable. After Dr. Radhakrishnan's treatment, it healed completely within months.
The itching and swelling in my legs were affecting my whole life and activities. I couldn't stand for long periods, which was a problem for my job as a daily laborer. Now I can be on my feet all day without pain and discomfort.
The procedure itself takes just minutes, requires no anesthesia, and patients can often return to normal activities the same day. A compression bandage is applied for just 3 weeks, much shorter than the months of compression required after conventional treatments.
In almost 90% of the cases, one sitting is enough. And the beauty is, this can be done at any age, even for patients with other health conditions who might not qualify for surgery.
However, Dr. Radhakrishnan emphasizes one crucial aspect of successful treatment: the importance of essential follow-up care. He has developed a 6-year follow-up schedule to monitor patients and address any recurrence, ensuring the long-term success of the treatment. Dr.N Radhakrishnan's groundbreaking method not only challenges long-standing medical conventions, it is backed by rigorous scientific research. At St. Thomas Hospital in Tanganashari, he established the St. Thomas Institute of Research on Venous Diseases and the Dr.N Radhakrishnan Foundation for Research on Venous Diseases. His collaborations with the Rajiv Gandhi Center for Biotechnology explore the genetic and molecular roots of venous disorders.
At Mahatma Gandhi University, he leads Dr. N Radhakrishnan International Center for Medical Innovation, India's first research center devoted exclusively to venous diseases.
Our knowledge about this disease is very less, not only among patients but also among medical professionals. We still maintain the same sphere of thoughts which are centuries old.
In 2008, when I was doing lots of work on venous disease, I thought that I should make a foundation for the further development of the research work in this field. And with the help of Professor Dr. M.S. Valyathan, I was able to start work in genetics on venous disease in Rajiv Gandhi Center for Biotechnology, Trivandrum. That went on for about 15 years. We had published a few papers on that. At the time, when it was almost in a fertile stage, I thought that we had to do further research on something which will further benefit the human being. So it was at the time, 4 years back, Dr. Abu Thomas casually mentioned that he is searching for some institution where he can treat this chronic ulcers by application of nanoscience. And he knew from somebody that I am the right person to proceed on that. And we had a discussion on the same day, and that was a landmark in the development of this institute. We started initially with nanoscience and technology, and we thought that we will publish a book on management of non-healing ulcers. And later, we thought that we'll make an institute in the Mahatma Gandhi University, when he was the Vice Chancellor. And he is the Director of Nanoscience and Technology. And we jointly started work on venous disease. And this institute, Dr.N Radhakrishnan International Center, is fully funded by the research foundation, my name. So now it has come to this level, which you are seeing.
Dr.N Radhakrishnan International Center for Medical Innovation is affiliated to Mahatma Gandhi University. It is established in April 2023, and it is a philanthropic funded center by Dr. N Radhakrishnan Research Foundation for Venous Diseases. Here the center is mainly focusing on researchers mainly related to venous diseases. And we have a centralized facility for molecular biology research. There is a specialized molecular biology research lab and also a cell culture facility. They're related to so many cancer biology researches are going on, and especially some vascular diseases research based on that. And we have collaborations with medical colleges, hospitals, for carrying out various researches and projects as part of the center. The center also has a facility for startup and incubation, and where we are mainly focusing on medical innovations. And there is a specialized dedicated space for the medical innovators to work and collaborate for their research and come up with commercially viable medical startup solutions for various problems in and across the world. And we have already signed MOUs with medical colleges and affiliated research institutions. And we are carrying out some international collaborative projects as well. Currently, we are in association with the National University of Singapore as part of a cancer biology research. And also, we are in close collaboration with Walter Sisulu University, South Africa, for carrying out a major research project based on this genomic instability of this varicose venous diseases. So the center is mainly having researchers, project students, trainees and interns as part of carrying out various researches and projects based on this venous diseases.
The NRICMA Dr.N Radhakrishnan International Center for Medical Innovation Research Hub of Molecular Biology at DMG University. And our research currently focuses on 4 major areas. First one is biomolecular studies of venous diseases. Then innovative material development for wound management, microvascular perfusion mapping of heart-related diseases, genome instability and cardiovascular diseases, and also inflammation research. In biomolecular studies of vascular diseases, we particularly focus on exploring the complex molecular pathways that underlie the chronic venous hypertension and chronic venous ulcers. We are targeting to develop novel therapeutic strategies and identify novel therapeutic targets to improve diagnosis and treatment of mentioned diseases. In innovative material development for wound management, our team is actually developing biocompatible regenerative materials such as hydrogels, aerogels, and nanocomposites to accelerate the wound healing, thereby facilitate better environment for tissue regeneration and all. In the case of microscopic perfusion mapping of heart diseases, we are using advanced imaging and computational methods to understand the microcirculatory disturbances in cardiac disorders. And further in genome instability and inflammation research, we are actually investigating how genomic damage and persistent inflammation contribute to onset and progression of chronic diseases, particularly vascular and degenerative conditions.
One of Dr. Radhakrishnan's most profound insights is that varicose veins cannot be permanently eliminated. The venous system has remarkable regenerative abilities, a quality that helps us heal wounds, but also means that veins can regrow after treatment.
We can never destroy the veins and lymphatics so long as there is life in the body. It is fully protected by nature. It can regenerate to any extent depending on the requirement. So the treatment for varicose veins is to control the complications and never for a permanent cure.
This understanding that those varicose veins require ongoing management rather than a one-time cure has shaped Dr. Radhakrishnan's approach to patient care. His center has grown from treating 8 patients in 1997 to more than 3,000 annually today.
Dr. Radhakrishnan's revolutionary insights didn't stay within the walls of patient care. His research works were published in high-impact international journals, caught global attention, and led to in-depth scientific considerations across the globe.
In 2014, he published the book, A Treatise on Venous Diseases, followed by his masterwork in 2022, Genesis, Pathophysiology and Management of Venous and Lymphatic Disorders, published by Elsevier and distributed across 248 countries. These books have fundamentally changed how medical professionals worldwide approach venous disease, establishing the new subspecialty of phlebolymphology and reshaping treatment protocols globally.
Professor Dr. N Radhakrishnan's journey represents more than just a new treatment methodology. It represents the power of questioning established wisdom and looking deeper than the surface. By focusing on the microscopic rather than just the visible, he has transformed our understanding of a condition that affects billions worldwide.
For the thousands who have found relief through his innovative method, modified microfoam sclerotherapy, Dr. Radhakrishnan is more than just a surgeon. He is a pioneer who discovered what others overlooked, that sometimes the most powerful breakthroughs begin in the smallest veins. His legacy continues to grow with every patient who walks out of St. Thomas Hospital with healthier legs and renewed hope.
The veins are the saviors as well as the basic protectors of the body. Our job is not to destroy them, but to understand them and guide them back to health.
In a world where medical technology grows more complex by the day, Professor Dr. N Radhakrishnan stands as a timeless reminder. Those true breakthroughs are born not just in labs or machines, but in a mind that dares to see simplicity amidst complexity. His legacy is not only in the minds of patients he healed, but in the path he paved. One that may forever reshape the future of vascular care.
Though he never seeks the spotlight, Professor Dr. N. Radhakrishnan remains as committed as ever, continuing to share his knowledge, inspire the next generation, and carry forward the quiet brilliance of a life devoted to healing.